Hi Venus, hope you're doing good. So this is Dr. Srikanth from Team MDS CONQUER, and now in this session we'll be discussing about remineralizing agents. Okay, and of course most of you are familiar about the term demineralization and remineralization. So first, just look into the basics of what happens in this remineralization-demineralization cycle, which we have already discussed in a karyology video. So whenever your bacteria in combination with food, that is carbohydrates, is going to lead to secretion of acids, lactic acid and everything. And this lactic acid reacts with saliva and decreases the pH of saliva. So whenever the pH of saliva is decreased to 5.2 to 5.5, which is basically called as critical pH of enamel. So whenever your saliva hit this particular pH, enamel start dissolving. So that is called as demineralization. Whenever your pH become normal, again enamel start remineralizing. So this movement from one side to other side is called as demineralization, remineralization. So caries balance is basically demineralization and remineralization, the balance between the demineralization and remineralization. Whenever there is a demineralization, caries is going to occur. Whenever there is a remineralization, caries will not occur. So here are the factors to be taken into consideration about the demineralization and remineralization according to your students. So what are the factors? I already told. Acid producing bacteria. What acid? Lactic acid. Or you have subnormal salivary flow, or there is impairment in the flow function of the saliva. Okay, so that is something like a xerostomia. So whenever there is a decrease in the salivary flow rate, so that is called as xerostomia. In such conditions, you are going to have demineralization. Similarly, whenever there is a radiation, head and neck tumors are there, the patient is going to radiation. The radiation is going to decrease the parenchyma of your salivary glands. That leads to decreasing the saliva secretion. Okay, so that is called as radiation caries, that most of us are familiar. Okay, right? And followed by frequent eating and drinking of carbohydrates. So we have already discussed about the food. Food is carbohydrates. We have discussed about the bacteria. We have discussed about the acids. And of course, poor oral hygiene, not removing the plaque on time. So all these can lead to demineralization. On the other hand, whenever you have a good salivary flow rate, salivary components or salivary buffering capacity is very good, in such conditions, there will be remineralization, that is protective factors. Remineralization will move around. It can be a fluoride remineralization. It can be calcium and phosphorus. Good oral hygiene. Controlling, maintaining of healthy microorganisms in the oral cavity, that is probiotics or prebiotics or arginine. So all these can be asked as a questions. Or pH modifiers. I already told you, buffering capacity of saliva is very, very important. So pH modifiers, okay. So xylitol and all these are going to act as pH modifiers, which are going to be the protective factors in protecting the teeth and preventing the caries to occur. Or you can use some strategies to modify the microbes that are basically causing the caries. Okay, so that can be, you can use salivary ions, tin ions, you can use antimicrobes, or you can use peptides, any of these which are listed according to students. So now you got a clarity about demineralization, remineralization, how it occurs, and how remineralization is going to protect the teeth from the dental caries. And one of the most commonly used remineralizing agent in the clinical scenario, and where most of your questions are going to come from, is fluorides. And I don't want to talk much about fluorides because fluorides is completely a different topic, a preventive topic which is covered in your community dentistry. Okay, so what basically fluorides do, we'll be discussing here. Then we'll be moving into the other most commonly used remineralizing agents where the questions are going to come for you. So what fluoride is going to happen? And most of you are familiar about this structure, hydroxyapatite. So whenever hydroxyapatite is going to react with the fluoride, it is going to form fluorapatite and fluorohydroxyapatite. And if you check out the crystal size of this regular hydroxyapatite to that of the fluorohydroxyapatite, the fluorohydroxyapatite crystal size is more. There is more size. And we have already discussed the critical pH of normal teeth, that is normal hydroxyapatite, is 5.2 to 5.5. Whereas fluorohydroxyapatite, it is 4.2 to 4.5. Means it requires more change in the pH for the dissolution to occur. More size, more pH is required. I mean, the less pH is required, more acid is required for the dissolution of this. So this makes fluoride treated teeth more resistant to dental caries, and this fluoride benefits can be obtained by the teeth only when the fluoride concentration is very low. That we have already discussed. The fluoride concentration should be 0.2 to 1 ppm. Whenever the fluoride concentration is more, there is more damage than the prevention. So prevention of dental caries occurs when the fluoride concentration that is available is low, in the range of 0.5 to 1 ppm. The rest, everything, activities, different agents and everything of fluorides were discussed in your fluorides video, smart video, which is present in your community folder. Okay, so now I'm jumping into the most common agents that are important for us in the examination point of view or in the clinical scenario point of view. Okay, you don't require heavy notes here. I mean, apart from fluorides, the other agents that are required is CPP ACP, right? One is CPP ACP. Then the second one is CPP ACP plus fluoride. Okay, CPP ACP plus fluoride is a different agent. Agent number 2. Then agent number 3 is xylitol chewing gum. Okay, so apart from this, we are going to discuss few other aspects, few other agents. Okay, but those agents are not very important from the examination point of view. But yeah, of course, sometimes the bouncers are going to come, so we have to read everything. So we'll be discussing some 5 to 6 agents, out of which I'm clearly telling fluorides is one important. Damn sure you'll be getting a questions on fluorides. The second important agent is CPP ACP. The third important agent is going to be your xylitol. So these are the 3 mandatory things you have to be clear with each and every line regarding this. Okay, so first we'll be starting about CPP ACP. CPP ACP is commercially available with a commercial names called as Recaldent. They can ask you Recaldent, or it is called as GC tooth mousing, and MI paste. So all these commercially available pastes are going to contain the ingredient called as CPP ACP. Okay, CPP ACP, that most of us are very clear. That is that is casein phosphopeptide. CPP is casein phosphopeptide, which is basically obtained from your milk. Okay, so that is casein is basically obtained from the milk. Okay, and as it is obtained from the milk, it has phosphoproteins, and it is basically a protein nanotechnology, which is first started by Eric Reynolds. Okay, and this was approved, or the patency rights were taken by Melbourne University in Australia. So all these can be questions. So we have discussed about CPP ACP. CPP is basically casein phosphopeptide, which is obtained from the milk, and there is something called as ACP. So what is this ACP? Amorphous calcium phosphate, and this calcium phosphate are present as a particles, and the size is nanoparticles of ACP mixed with casein phosphopeptide is going to give rise to CPP ACP. Okay, the next important aspect that they can ask is the protein sequence, amino acid sequence that is present, because we have discussed, right, this is a protein technology, right? Clearly mentioned this is a protein technology. What is protein? Protein is a group of amino acids, biochemistry part. So what are the amino acids and their sequence, they can ask you. So this particular thing is important. Glutamine. Okay, right? So this sequence, they can ask you the questions. Okay, now where do you CPP ACP is going to come into existence? CPP ACP is already, we have discussed, white spot lesion. The regular treatment of a white spot lesion is remineralization. Okay, but whenever they're asking a question, okay, the mode of treatment of a moderate to severe white spot lesion, then your treatment plan slightly varies. We regularly don't go for a regular remineralization. Then we can try a different approach like resin infiltration and everything, which is INICET question, which is already discussed here. Okay, so it is used in the treatment of white spot lesion, and we know white spot lesion is also called as subsurface demineralization. Means what is going to happen? Okay, so surface is intact, this enamel surface is intact, but there will be some sort of demineralization that is going to occur below the surface. Okay, right? So now your remineralizing agent has to penetrate, break this enamel surface, and has to enter inside. That is what required, right? And it regularly not happens. So what is going to do? Before you treat CPP ACP with a white spot lesion for the treatment of remineralization, you have to itch this area sometimes, or sometimes you have to itch along with, you have to pumice, you have to apply a pumice and polish this area so the debris and everything will be removed. Okay, so what is going to happen? There will be access for your CPP-ACP to enter into the white spot lesion and clear the white spot lesion, right? So very, very important concept. CPP-ACP is used in remineralizing the white spot lesion. So before going with the procedure of application of CPP-ACP to the white spot lesion, you should itch and polish the surface so that your CPP-ACP is going to access the demineralized area which is present below the enamel. Okay, right? I hope you guys are very, very clear about the CPP-ACP. Then we'll be talking about what is basically going to happen. Like, for example, you imagine this as your tooth, and we have already discussed there is some demineralization that is happening. Demineralization is nothing but loss of calcium and phosphorus. Okay, and these calcium and phosphorus are lost whenever it hits critical pH. Okay, so what happens? The advantage, the critical pH is like the saliva is also having calcium and phosphorus, a very rich calcium and phosphorus are there. So whenever the saliva reaches its normal pH, so there will be demineralization, remineralization that's going to start. Means your calcium and phosphorus which are lost will be coming from the saliva. Okay, saliva. So this is basically from the saliva. Okay, so it's going to happen, but the phase at which this remineralization is occurring is going to be very, very slow. What is the advantage of CPP-ACP? Whenever you keep CPP-ACP, apply the CPP-ACP, CPP-ACP is going to create an environment around this. And this environment, okay, what is created around the enamel, which is already demineralized, is going to contain lots of bulks of ppms of calcium and phosphorus. Okay, that is nothing but called as super saturation. Means very heavy, rich calcium and phosphorus are there, which are completely feeding you. Okay, so this feeding will give the advantage of remineralization to occur at a faster rate. So that is the biggest advantage of using the CPP-ACP. Okay, so other things which are listed out in the textbook, okay, which you can understand. Point number 1, availability of calcium levels in the dental plaque. So that is what I was talking. The super saturated calcium and phosphorus is available. The availability is more, so it's going to absorb fast. The second one is it is going to bind to the adhesive molecules. Adhesive molecules and everything we'll be discussing in the general histology. So adhesive molecules on the Streptococcus mutant and thereby interfering with them, and thereby they are going to decrease the number of these microorganisms in the plaque. Okay, so apart from providing high rich calcium and phosphorus, they are going to inhibit the interaction phase of Streptococcus mutant. Okay, the third one. Okay, so there is something like a buffering capacity which we will be discussing in dental histology. So this third point is related to buffering capacity. Okay, so you have protein and phosphate buffering capacity of the plaque. So we know that the plaque pH is being dropped down to 5.2 to 5.5, which is causing the demineralization, and this CPP-ACP is going to buffer and make this 5.2 to 5.5 to a normal pH as quick as possible. So these are the three big disadvantages when you're talking about the mechanism of action of CPP-ACP in the oral cavity in preventing the dental caries, right? Okay, a very frequently asked question in the NEET and INICET is which of the following is a remineralizing agent? Simple answer is CPP-ACP. Full form of CPP-ACP was asked in the exams. You know that casein phosphopeptide, amorphous calcium phosphate. CPP-ACP is the patency rights, or the first invention was done at what? Okay, so Melbourne University of Australia is again a question that is asked previously. Treatment of white spot lesion, regular treatment of white spot lesion. Yes, right, you guys are right. The answer is applying a remineralizing agent. Okay, CPP-ACP. Moderate to severe treatment of white spot lesion, already discussed. The answer is resin infiltration, INICET question. Now I told you there is a slight variation. Now I have CPP-ACP. I know that the fluorides are being used as a remineralizing agent over a period of time, over decades. So now I have freshly made CPP-ACP. Chalo, let's add both of them. CPP-ACP plus fluoride. Okay, that is called as CPP-ACFP, which is basically called as tooth mousse plus, GC tooth mousse plus. What is going to contain ACPF is nothing but acetified calcium phosphide, which is going to contain fluoride. How much amount of fluoride? Yeah, this is a question that is asked in the exam. Okay, right? So please do make a note. Okay, the amount of fluoride that is added is 900 ppm of 0.2 sodium fluoride is added. That is an extra ingredient which is present in the CPP ACP plus or tooth mousy plus. Okay, clear, right? I hope this is a slight variation of CPP ACP. What question was previously asked in the exam is 900 ppm of 0.2% of sodium fluoride. Okay, right. So apart from the fluoride, CPP, ACP, I told you the third important thing is xylitol, which we'll be discussing. Okay, but as of now, there are a few other important agents which has been used. So let's have a quick glance. Okay, so make sure you try to prepare notes and try to check out these things as quick as possible, as frequent as possible, apart from CPP, ACP, and fluorides and xylitol, which is frequently known and you're familiar, because these MCQ books are going to contain these three agents only, but not the rest what I'm discussing. Okay, now the other agent that we have to make a note is beta tricalcium phosphate. Okay, beta tricalcium phosphate. Okay, if they're asking the commercial name, they can ask you. ClinPro is a very common commercial name that is regularly used. Okay, so what is this TCP? Okay, so TCP we have discussed, that is tricalcium phosphate. Okay, CaCO3 PO4 and this exists in two forms. One is alpha form and second one is beta form, and beta form is more required for us. It is more stable and less soluble. It is more stable and less soluble, similar like your beta form of Gatapacha. Okay, right? So we have discussed it, alpha and beta form of Gatapacha. Beta form of Gatapacha is whatever Gatapacha you regularly see in the department. That is more stable. Whenever you heat this beta form of Gatapacha, the beta form of Gatapacha is going to convert into alpha form of Gatapacha, which is not stable, right? So clearly we know already beta is stable. Beta is stable. Okay, right? So similarly here also beta is stable. Gatapacha, beta is stable. Okay, and TCP also, two forms, alpha and beta. Beta is stable and it is less soluble. Okay, so now when I'm talking about TCP has a disadvantage. What is the disadvantage? The TCP level should be as low as possible. Okay, as low as possible. It should be less than 1%, because okay, whenever its percentage is more, it is going to decrease the availability of calcium and phosphorus, because it's going to react with the calcium and phosphorus. Okay, and it will make the availability of the fluoride as low as possible. So that is the reason why your TCP should be less than 1%. Whenever your TCP is more, it reacts with the fluoride to form CaF2. We know that CaF2 is going to form calcium plus fluoride is going to form CaF2. Whenever CaF2 is being formed, your fluoride availability will decreases. If fluoride availability is decreases in a remineralizing agent doesn't have a role. Okay, so what is going to happen? Your TCP is a molecule. Okay, and this molecule is basically coated. Okay, you can see the red wala. Okay, so that is basically what I'm trying is I'm coating this TCP and I'm trying to protect it. Okay, so with what I'm coating this area, with acids, carboxylic acid and surfactants. Okay, so that the availability of the fluoride will be more. Whenever my fluoride availability is more, the chances of caries decrease will be high. Okay, I hope you guys are very clear with this particular concept. Okay, so then I'll be jumping into the next remineralizing agent that you have to make a note, that is Novamin. Okay, so Novamin, I hope a few of you have heard this terminology. So Novamin is basically a bioactive class. Do make a note, basically a bioactive class. It can be used primarily as a desensitizing agent and decreasing the dentinal hypersensitivity, and of course it can be used for remineralization also. Okay, the other important aspect is composition. Bioactive glass, whenever there is a glass, the primary ingredient in the glass is going to be SiO2. The very common sense. Okay, whenever you have a glass, the primary ingredient is going to be your SiO2. So SiO2 is going to occupy 45%. The main disadvantage of Novamin is going to form hydroxycarbonate apatite. Okay, so before starting the class, I have discussed fluorapatite. Okay, fluorapatite is there, but Novamin is what Novamin is forming? The Novamin is forming hydroxycarbonate apatite, which is easily soluble when compared to that other fluorohydroxyapatite or fluorapatite. So that is a disadvantage of Novamin using as a remineralizing agent, but it has a very good role as a desensitizing agent. Okay, right? Desensitizing agent. So that is main important. What are the highlights of novomin? Novomin is a bioactive class. Whenever there is a bioactive glass is going to contain SiO2. SiO2 is 45%. The primary use of novomin is desensitizing agent rather than remineralizing agent. The biggest disadvantage that you have to make a note is it is forming hydroxyl carbonate apatite, which is easily soluble when compared to that fluorapatite or fluorohydroxyapatite. So these are the main things that you have to make a note related to novomin. Okay, then comes pronamel. Okay, so what is this basically? Okay, it is having P and it is having N. Okay, so it is basically containing potassium nitrate. P and N, potassium nitrate, easy to remember, and this is obtained from Sensodyne that most of us are familiar. So again, what is the primary role of potassium nitrate? Okay, your pharmacology question. Okay, I'm talking about dental pharmacology, which is a part of your general pharmacology according to the NEET and INICET. So the main ingredient, the main function of potassium nitrate is desensitizing agent. So it helps in dentinal hypersensitivity treatment. So apart from this 5% of potassium nitrate, this particular agent is going to have sodium fluoride also, that is 1500 ppm of sodium fluoride, which is basically responsible for occurrence of remineralizing. Of course, any toothpaste, any fluoride toothpaste is going to contain in the range of 1000 to 1500 ppm, and similarly this toothpaste, along with desensitizing property, because of the presence of 5% of potassium nitrate, it is going to have 1500 ppm of sodium fluoride, which is causing remineralization. So this agent is useful for desensitization as well as remineralization. Desensitization because of potassium nitrate and remineralization because of sodium fluoride 1500 ppm. I hope you guys are very clear. So I'm going to the next important remineralizing agent, anamelon. Okay, so what is the anamelon? Anamelon is going to contain calcium, because what are the agents which are primary ions which are required to prevention of dental caries? Of course, we have a list of agents which ions which prevents the occurrence of dental caries or which promotes the occurrence of dental caries. Of course, a question in 2025 NEET examination, of course, discussed in the previous sessions. Okay, but the primary things, like when I'm talking about the primary things, yes, calcium is the primary thing, phosphite is the primary thing, fluoride is the primary. These are the requirements. So this anamelon is containing all of this. Okay, that is containing calcium, that's containing phosphite, and that's containing fluoride in the form of sodium fluoride, and all of these are reacting to form complexes. And what they code is, they told their formula is available basically as a liquid calcium. So whenever your liquid calcium is there, liquid calcium is going to deliver fluoride along with calcium phosphide complexes. Okay, so that is the mechanism on which this anamelon is going to work out. Okay, right? So last but not the least, and the important fellow, as I already told you, okay, so xylitol. Okay, so what is xylitol? Okay, beauty of xylitol, the first important question which was repeated so many times in the examinations and in INICET. Okay, INICET, any national board exams, okay, in ADC, so many times this question was given. So xylitol chewing gum, sugar-free xylitol chewing gum is a very commonly repeated questions in any sort of national boards and everywhere. Okay, right? So xylitol is a 5-carbon sugar alcohol. Very important thing that you have to make a note and you have to add it to your notes. It's a 5-carbon sugar alcohol. One. Second thing, the advantage of using xylitol, as we have already discussed, there is acid production. The acid production is lactic acid. Okay, and this xylitol is going to prevent demineralization and it's going to enhance remineralization. Okay, so it can reduce the lactic acid production in the dental plaque and resulting in increasing in the pH and promote the shift of this ecological shift. That is, we are talking about this acid base cycle shift, right? So it is going to shift, and of course xylitol carries calcium into the initial white spot lesion that helps in remineralization. So it can be used in treatment of white spot lesion because it's a remineralizing agent, to be noted. So very important point to be noted about the xylitol is 5-carbon sugar alcohol. It prevents the demineralization and it promotes the remineralization to occur. Okay, right? So one more advanced topic I want to cover along with this remineralizing agents is ozone therapy. Okay, so ozone therapy, I hope, like, you know, ozone layer and everything. Okay, so that we have discussed in the that we have done in the 11th and 12th standard. But ozone inclined to dentistry will try to discuss here. Okay, so ozone is basically is one form of oxygen that is basically having high energy form of oxygen. And the basic advantage, as it is carrying the high energy, the basic advantage, it can penetrate the decayed tissue. Okay, so it can penetrate the decayed tissue when applied, and it's going to eliminate the bacteria, virus, and fungus. Okay, it removes 99% of microflora, and regular ppm doses that is regularly used is 2200 ppm for 10 to 40 seconds is the application time of this ozone. Okay, so check out when you're checking out the uses of this in dentistry. Okay, it helps in the removal of caries, treatment of caries, prevention of caries. It can be used in few steps in root canal therapy. It is used as a tooth whitening agent. It helps in decreasing the sensitivity. It helps in treating the gum diseases. It can be used as a pre-wash of the surgical sites before you start implants. It helps in controlling the cross-infection contamination between the dental units, and it can also be used in the white spot lesion treatment to remove any sort of microorganisms that are present in the white spot lesion. Okay, so these are the lines which are taken from the textbooks, and do make a note and do practice it. Ozone therapy, yeah, advancement, right? So we can predict a question from this particular area. So yeah, before we end, one of the important favorite topic of present trends is silver diamine fluoride. Okay, so this is a case, right? You can see a lesion, and over a period of time after the treatment, you see the lesions are being discolored, dark colored, discolored. That's the biggest disadvantage. Okay, so this is a treatment done, a good treatment done, okay, where you're preventing prevention treatment that is done. But the disadvantage of this prevention treatment of our application of this silver diamine fluoride is discoloration. So this is a case-based question they can ask. Okay, before and after, they're going to tell you they are undergoing a preventive procedure that leads to discoloration of the particular teeth, and they can elicit this photographs before and after the treatment. If you check out, okay, so these are the very important lines which are taken from McDonald. Each and every line is a question. Okay, so we'll try to understand what they are basically. Okay, silver diamine fluoride, SDF, is a topical solution useful for caries arresting and anti-hypersensitivity agent. So dentinal hypersensitivity also it is used. And this already, the word itself is telling SDF. Okay, S and F are very, very important. So this is basically contains silver and fluoride. Okay, silver and fluoride. Silver, S for silver, F for fluoride, which plays a very, very important role in caries arresting and treatment of hypersensitivity. So these two ions plays a very, very important role. The first is slide what we have started today's discussion with the remineralizing and demineralizing. Silver is also clearly mentioned along with the tin, silver, fluoride, calcium, phosphorus. Okay, so silver is clearly mentioned. So what is the advantage of silver? Silver, as we are dealing with the silver is antibacterial. Silver is antibacterial. So silver is antibacterial and slows the demineralization and enhances the remineralization. Okay, and enhance the remineralization. So it is recommended to arrest large cavitated lesions which cannot be handled by the conservative treatment protocols. And we have already discussed with the case based what we have started is a line that is straight away, and this is 2 times repeated in INICET till the date. Okay, that is the main disadvantage of this SDF, is that it precipitates the silver ions and the caries dentin become stained black. You can see in this case the caries dentin, whatever the caries dentin that is available here, is turned into a stained black color. So that is the main disadvantage of using this SDF. And of course this SDF can be used in preventing the root caries lesions also. Okay, it helps in preventing the root caries lesions also. So coming to the applications, which are application methodologies, numbers which are given in the McDonald, that has to be noted down. The reason is nowadays you see INICET NEET has a habit, habit of giving a straight away lines, like you see the national boards or ADC or any other international license exams or other exams, they have a habit of giving an application part over the content which is there in the standard textbooks. But here, if you see, they're going to give numbers. They're going to give numbers to refine the students. Okay, so it's mandatory. You, sometimes for a very important topic, you need to check out what are the exact lines which are taken from the textbook. So if you go and observe, the application of this SDF usually requires removal of biofilm. Okay, so for anything we have to remove the biofilm, dental plaque, everything has to be removed, pumice has to be applied, and polishing has to be done, by which the biofilm or the dental plaque we are removing, followed by the application of the product with a micro brush for about 3 minutes. So you're going to apply for 3 minutes and rinse that area with water and cover the lesion with fluoride varnish. And as we have discussed, this is having a problem of staining. So I'm going to protect my gingival, the patient's gingival tissue, and the lip should be covered with petroleum jelly to avoid staining. So by which I am avoiding the staining of this gingival and the lip soft tissue which is surrounding this particular teeth. And it was also reported up to 50% of arrested lesions were reactivated by 24 months after one application. Okay, so normally it is useful for normally it is useful for the caries lesions as well as for remineralization as well as for desensitization. But the reports are telling that the 50% of the lesions which are arrested because of application of this SDF were reactivated within 2 years. Okay, so these are the main things that you have to make a note when I'm talking about remineralizing agents in specific. Okay, and along with this particular video, okay, so when you're going for the prep, make sure you have to finish the smart videos of the fluorides. Okay, because one of the most commonly used ingredient for remineralizing in the dentistry is fluoride. Okay, and the paper setter's choice, any sort of exam, you take your theory exams or you take your national boards, INBDE, ADC, okay, or LDS, whatever it is, like any sort of international license exams or trans exams or government exams, fluorides is one of the most important topic to be considered. Apart from fluorides, the other important remineralizing agents which are trendy now is definitely tooth mousy plus, which is nothing but called as CPP, ACP, chewing gum, xylitol. Okay, so these are the areas where most of your questions are going to move around. Make sure prepare a short, sweet notes so that the revision is going to be easy. Okay. As of now, signing off, Dr. Srikanth from Team MDS CONQUER. See you very soon. Bye.